Welcome to Burst TV, where today we're going to talk about equipping your favorite seniors. Well, aging has many challenges. There are 3 that can really impact the self-care for seniors. We're going to talk about number 1, dexterity issues, 2, cognitive impairments, and 3, xerostomia, which is really just a fancy way of saying dry mouth. So my name is Rachel Finley Norwood, and while it's true I'm a dental hygienist and a Burst ambassador, I'm also an expert at working with seniors. How is that? I'm sure you're wondering. Well, I've been teaching specialized fitness classes for seniors for the last 14 years. And actually, right at 8 years ago, I developed my own brain and body fitness program for them. At this point, I have visited over 50 different senior living communities. That's both in the United States and Canada. And so I'm pretty aware of their needs. So today we are just going to focus on the dental ones. And I want to do a little brainstorming with you, and I mean that. So if you have ideas outside of my own, I want you to put those in the comments. If you think there are other challenges that I'm not covering in the video today, then jump in there and let me know what those are, and maybe we can cover them in another segment. Number 1 is going to be dexterity. Arthritis, muscle atrophy, and other injuries or diseases can make a senior's grip change. That skinny manual toothbrush that they've been using forever and ever and ever may not work for them very well anymore. They might not be able to get their hand around it the same way, and they may not be able to manipulate it the way they once were able to. So my suggestion for you is to look for a toothbrush with a wider handle. This is a sonic toothbrush, and sonic toothbrushes are what I always recommend for my seniors. 1, because of the wider handle and the better grip for them, but 2, because when you clean sonically, you're cleaning by vibration and not by how hard you're having to scrub any one area. So it's gentler and easier for someone who has dexterity issues. Okay, so I moved into the fitness studio because there's something else that you can do to help your favorite senior with dexterity. And that's gonna be to offer them a really cool hand exercise. Just have them open and close their fingers as wide as they can. Repeat 10 times and then just shake it out. This will increase blood flow to the area, making the hands feel warmer. And that's good for everybody, but especially those with arthritis. Number 2, let's talk about cognitive impairments. So unfortunately, this is something that's becoming a lot more common these days. Many of us have been impacted by having a loved one with Alzheimer's, dementia, or Parkinson's. And those 3 conditions make the activities of daily living really difficult. So what can we do for someone that has a memory deficit? Well, 1, again, I would recommend the sonic toothbrush for a couple of reasons. 1, because of the way that it does the heavy lifting of the cleaning for them, so they don't have to think as much about how to clean. They might need someone to remind them to keep moving it around. But the other thing is it has a timer. Most sonic toothbrushes have a 2-minute timer. And so the person doesn't have to remember how long to brush. When the toothbrush turns off, they know they're being cued to stop brushing, and that's also really important. You might even think about putting a sticker on their mirror, and you could have it, you just handwrite on a little sticker, "Have you brushed your teeth this morning?" And then if there's not enough room to write more on there, then make a second sticker and have it say, "Have you brushed your teeth this evening?" That would be a great way to remind them that they need to brush twice a day, and you don't even have to say anything to them. It's just right there on their mirror. Let's talk about our last big issue, and that is xerostomia, another fancy word for dry mouth. Many of our seniors face having dry mouth, and there's lots of reasons for that, but medication is often to blame. A dry mouth is uncomfortable. Just drinking more water isn't going to make it better. And the big concern is that a dry mouth is much more likely to develop decay. Now, why is that? Well, saliva acts as a natural surfactant. So all day long when you're swallowing, it's kind of rinsing off your teeth. When a person has dry mouth, they don't have that perk anymore. So anything that they eat that has sugar on it is going to stick to the tooth, and it's going to make it much easier for cavities to get started. Cavities can't start if the tooth is super clean. So it's just crucial that their home care is excellent when they have a dry mouth. So how can they do that? Again, I hate to keep saying it, but I would definitely have them get a sonic brush because it's just going to make their mouth cleaner. I would also recommend a good fluoride toothpaste. You choose what kind. This is just one that I have here at home that I really like. The fluoride in the toothpaste will help keep the enamel stronger, so it'll be more resistant to having cavities start. And then the last thing you might think about as far as dental products is a water flosser, because a water flosser is going to spray water in those interproximal or in between spaces around the teeth. So it's going to help clean out whatever their toothbrush couldn't reach and get underneath the gums as well. Again, giving them the best shot at having a super clean mouth despite the fact that it's a dry one. Another thing that you could think about doing for your favorite senior with dry mouth is getting them some xylitol mints or gum or candy. The xylitol will stimulate the salivary flow, but it will inhibit the growth of bacteria. Versus if the person just picks up the habit of sucking on hard candy now, the hard candy probably is sweetened with sugar, and that'll actually encourage the growth of bacteria and actually feed it. And we don't want teeth full of holes. We don't want the sad face like this guy has. We want the happy, healthy teeth. Had to show this off. I made this pillow when I was in dental hygiene school. Moving right along, in all seriousness, I cannot talk about xylitol without this important reminder. Please, please, if you have pets, don't ever leave products with xylitol where your pets can reach them. If you want to carry xylitol gum in your purse, that's wonderful, but please make sure it's in your purse, zipped up, put up where your puppy can't get it. For some reason, dogs seem attracted to that, and it's really bad for them. Xylitol is safe for humans, but not for animals. Their bodies don't process the xylitol the same way, and it can actually be deadly for dogs. So just keep the product put away, and it's good for everybody. Please share this video with your family and friends. If you have any questions, please leave them in the comments, and I can't wait to see what kind of conversation we're going to have going forward. I appreciate your time and look forward to hearing your comments. Have a good one.